The Durham Diabetes Coalition is a collaboration among the Durham County Department of Public Health, Duke University, the Center for Geospatial Medicine at the University of Michigan, and other Durham Health partners. The Durham Diabetes Coalition has a community and a clinical team. The community team is a team that's actually in the community where people work, live, and play. The neighborhood intervention team exists to increase awareness about type 2 diabetes and the serious complications that this disease can cause. We further exist to provide community-based activities. The overall goal is to improve health outcomes and quality of life for people living with type 2 diabetes and those who are undiagnosed. We do this by providing patient education, linking resources, and providing health interventions.
In the community, we go to various organizations and churches, and we provide a wide variety of diabetes presentations. We assist with health fairs, and we also offer diabetes self-management and chronic disease self-management programs. So we want to help diagnose those who don't know. And for those with type 2 diabetes, we want to help them better manage their diabetes, which will reduce their risk for complications such as amputations. Community partners are important in what we're trying to achieve with the Durham Diabetes Coalition because they help us to connect resources with community members, especially when there are resources that are helpful to community members and they may not be aware of.
You know, we're always there to listen, and we listen to what they need, and we try to provide them with what they need. Geospatial mapping helps us to identify the high-risk areas for diabetes. For example, in our target area 1, we were able to identify almost 600 people living with diabetes. And that was done through the geospatial mapping.
We're focusing in the first neighborhood because there are large cases of type 2 diabetes. And the same goes for the second and third neighborhoods, but it's just not as high as in our first area.
This helps us just to understand where the most services are needed.
To have a lasting impact, some things I would like to see are the creation of walking groups, support groups that we're working to get in the communities if they're able to sustain them when we're gone. We do plan to empower community members to be able to do diabetes presentations and offer education to other community members on diabetes. So with that, we hope that that'll be a way for people to continue spreading the word about type 2 diabetes and better ways to manage diabetes. When this project ends, the lasting impact that I would like to see are some of our initiatives continue. We don't want everything to end when the project ends because type 2 diabetes does not have an end.